Morning, everyone. The first thing to say is that I've stolen an image from an NIHR School for Social Care funded project. I don't know if anyone's involved with the Connecting People project in this room, but anyway, I've stolen the image because it's a nice image for actually connecting, bringing people together, bridging gaps, and helping to exchange knowledge and ideas. And since it was from SSCR project, why not? So I didn't ask permission, but anyway, it's there. What I'm going to do is I'm going to talk a little bit. Actually, I'll go back. What I'm going to do is I'm going to talk a little bit about a European project I've been involved in over the last 2.5 years or so, which has been looking at different ways in which people exchange knowledge, largely within a health context rather than a long-term care context. But nonetheless, I mean, the lessons apply equally, or the messages apply equally about things that work and things that don't work in terms of trying to actually exchange information. And one clear thing that comes out of that, and this is an obvious thing to say, but it should be said more often perhaps, is that things have to be done differently in different countries and different contexts. Because political structures, institutional structures, mean that the way in which you interact with policymakers in the UK is not the same way you interact with policymakers in many other European countries. So I'm going to draw a lot on that, but why am I doing this? Because knowledge is important, but knowledge is a value. And this chap here, if I don't get in the way of him, Horace Mann, American educational person back in the 19th century, looks a bit like Abraham Lincoln, I always think, but it's not Abraham Lincoln. And I put this up because I walked past this. This is actually also on the neurological hospital in London. If you ever go to Queen Square and you walk up that square, you will actually pass this phrase that is carved into the stone of that hospital. Every addition to human knowledge is an addition to true power. But it only actually works if people make use of that information. And actually, misinformation, lack of knowledge, also has an awful lot of power if it's not counteracted by the real evidence, the real information, so to speak. And we don't live in an ideal world. We don't live in a world where we simply produce reports, give it to the minister, and things happen. I mean, there are rare occasions where that does happen, it has to be said. And there may be a crisis occurs, or some work that's been going on for a long period of time suddenly is very topical, and it fits in with the debate. But that's pretty rare. So we don't live in this ideal world. We live in this complex, messy world. And this is an ancient slide from 2001 from the Canadian Foundation for Healthcare Improvement, which was called the Canadian Health Services Research Foundation back then. But the slide is as appropriate today as it was 13 years ago. And what it tries to do is it illustrates how messy, how complex it is to actually exchange information about health policy, about scientific evidence, and how you have to compete. Because when we're talking about messages for health, researchers are doing things. We're doing things, we're doing evaluations, we're generating all this kind of robust evidence. But that's not the only information that goes through to policymakers, to managers, to service professionals. There's an awful lot of other information going there as well. The power of the media, the power of think tanks, and in this country, these private organisations, usually not for profits, maybe linked to different political parties, political streams. They're very powerful actually in getting across messages or putting out ideas as to how services and so forth should be developed. There are think tanks, there are journals, there are all sorts of lobby groups, there's industry, all sorts of things, there's personal experiences. How often do we know about a situation where a minister is interested in a topic because somebody in his family has that condition? You know, I mean, I think this is going back a long time, but I vaguely recall in the late 90s, there was an initiative in France to invest much more in Alzheimer's disease. And again, I'm pretty sure at the time there was some link between high-level people in the government and dementia and families. Not that that's a bad thing, I'm just simply saying that things are influenced by many different things. And we live in cloud cuckoo land if we think that we're simply going to get messages across by producing a report or a good article in the Lancet or wherever, Health and Care and community or whatever. Is there a journal for us? Anyway. And the problem is the danger of a lack of knowledge exchange. Okay? Probably nobody in this room is old enough to remember W.C. Fields. American actor, wisecracking type person from the early part of the 20th century. But the danger is that if you don't have facts, you won't be dazzling people with brilliance, with good information. You'll be battling them with bull and bull-s maybe as well on there. So there is a danger of a lack of information, a lack of good ways of getting information across to people. The gap will be filled by poor information. A good example of this, actually, a very good example, is the MMR, measles, mumps and rubella vaccination business that was here a few years ago in the UK. Picked up, an article in a scientific journal, picked up by one newspaper, gets out into the public domain, and it doesn't matter how many pieces of evidence that come thereafter. It took an awful long time for vaccination rates in the UK to return to the levels they were at before that article was published. There are issues there about knowledge exchange and a lack of information, and we know that researchers are very bad at doing this. Researchers are pretty bad, apart from everyone in this room, I have to say, pretty bad at actually talking to policymakers, talking to practitioners in a language in a way that practitioners understand. And actually talking to is the wrong word, talking with, exchanging, having a dialogue. There's lots of work on this. I mean, again, this is quite an old study from Norway and colleagues, but there's lots out there about researchers speaking the language of research, policymakers doing their own thing, and not really interacting very much. Later work, G.D. Seber from the University of Sussex was talking about how research gets into practice and highlighting an evidence chain. And this is very much a British type of model or an American type of model. But what you'll notice here that the key people in terms of impacting on knowledge exchange in a UK or US-based context are special advisors to ministers. They're the people you want to try and reach. And then there are experts, whoever the experts actually are, professional associations, these think tanks, which are very influential in the UK, in my opinion. Lobbyists, media, consumers, and then down at the bottom, academic researchers. Very much at the bottom of the chain. So there's a lot for researchers to compete with. So there are challenges to knowledge exchange. It's not always communicated effectively. It's not always available in the right format. We have the 200-page long technical report. We don't have the one-page long key summary of what it actually means in a language that people understand. We take 10 years to do something instead of 10 weeks or 10 hours, as some people sometimes want. And it's a trade-off, but but I know there's more focus now on rapidly producing work and reacting to policymakers' ideas. But nonetheless, that has been an issue. It's not recognising sometimes that we have to change the way in which messages get across to a policy-making environment so that they are in a language that can be understood. Not everyone working in a civil service or even in a Ministry of Health is a scientific expert on the topic in question. So it's about actually getting across messages in an appropriate key way. And there are challenges as well in many countries, not necessarily in the UK, I have to say, of an opportunity for dialogue and exchange of information between those who produce information, like researchers and policymakers. I have to say in the UK we're pretty lucky. There's a relatively good culture of engagement between the academic sector and policymakers. It's quite strong, and there's a London effect as well. Clearly, if you're based in London, you're going to have more interactions. But nonetheless, but in some countries, the system is very politicised, and it's very, very difficult for a researcher at all to get anywhere near the policy-making process, and you have to think about a different way of getting messages across. I think there are extra challenges with long-term care as an issue as well, and things that you're familiar with. Responsibility. It may not be in one policy, may not be the responsibility of one policy-making department. You may potentially be talking about the Health Ministry, the Social Welfare, Social Protection Ministry. You may be talking about regional governments or local governments. And that adds complexity to getting messages across. Who do you coordinate with? Who do you talk to? Do you try and do things at a national level? Do you do things at a local level? And often I think as well it's not always seen as an immediate policy priority compared to issues like healthcare. And perhaps in countries, let's say like Spain, where historically families really have been seen as having to play a key role. I mean, I remember, maybe it is still the case in Catalonia, there's a law that says that you must provide care for your family member if they have dementia. Yeah, I'm looking at Julio because, anyway, but
He's not from Catalonia.
No, he's not from Catalonia, no, but anyway, but he's been to Barcelona. And I mentioned the point about the politicised civil service. And this is actually a key point that we may not think about that much, but there are many countries where, when the government changes, most of the key civil servants also change because they're political appointees. So if you actually start to build up relationships with civil servants, you may have to start that all over again. And there's also the issue as well with ministries and countries where there's a greater trend towards changing positions very quickly, so people don't remain within the same ministry for very long. And that also creates challenges as well. And again, it's trying to think of ways around that process so that the knowledge is institutional rather than being tied up in one individual. Now, one way to try and look at this is there's lots of terms for this, but one fairly fashionable word is knowledge broking, and that's actually to try and train people, maybe usually from an academic background, to actually know how to communicate, essentially, to know how to turn complex scientific information into more straightforward information, to get messages across not just to policymakers, but to the media, to other stakeholder groups as well. There are some training courses around now to develop these kinds of skills. It may be on-the-job training in the sense that you may be an academic and then you get a secondment to work in a Ministry of Health or long-term care or whatever for a period of time. It can be an individual, it could be like a champion, it could be someone like we used to have in England, there used to be these people called Tsars, which were like these, well, you know what Tsar is, an emperor type person. Anyway, have control or have a key responsibility for a particular area. We have people who have responsibility now for child services or child protection, child issues, I forget the exact name, those kind of things. But there are also units. There's one called the Personal Social Services Research Unit, which does this, I think, a bit. But it could be a network as well, the Skill for Social Care Research. There's some very good organisations out there. Networks as well. Yeah, I meant to type that down there and I forgot, to be honest. Potential role for networks, like the ILPN, that's what I meant to say, you know. And actually, things like the ILPN can be particularly useful where there is limited capacity in countries. Okay. I've still got, anyway.
Don't argue with the chair.
No, I won't argue with the chair. But there's limited capacity in countries, and that is also an issue, actually, because trying to network information, as has been done to some extent in some health jurisdictions, has been helpful in getting across messages. I mean, the best example of this probably is the Canadian example, where you have had federal organisations set up to think about evidence-based policy issues in health. And certainly they are used by some of the smaller provinces in Canada, but the larger ones tend to have their own separate evidence-based structures as well. Okay, 3 minutes to say something about Bridge. Bridge is a project that was undertaken, that was involved with the European Observatory on Health Systems and Policies, and we were looking at different ways in which information is actually, the mechanisms that are used to present information and to get that information to policymakers across the European Union. And it involved a lot of talking to various people. We assessed 398 organisations that have this role in 31 countries. We looked at 163 websites, and we did various visits and did case studies. And there was a case study on long-term care in England, I have to say, which demonstrated, by the way, that it can make a difference, academic work. I won't dwell on this for time, but I just want to shout some of the examples that you see. Some of this probably won't seem very unusual or whatever, but the kinds of things we're talking about, sometimes it's simple things like discussion forums, online discussion forums. Sometimes it's about new ways of communicating, not that new now, but online briefings, online webinars, where people can interact when they're not in actually the room. Different kinds of traditional training workshops, personalised briefings, parliamentary papers prepared for ministers, and dialogues. Now, I'll just say a quick word about some of these. I mean, just a quick example there, Discussion Forum, European Parliamentary Research Service. I'm sure you're all familiar with their work on long-term care research and the blogs and so forth. But they provided the opportunity for people to interact with the parliamentary service itself, and they in turn do have a very good relationship with MEPs in terms of these issues. An Estonian example was about blogging and trying to get information through blogs. But there are some challenges with some of these things. Sometimes they don't address issues systematically. Sometimes they're not timed to relate to policy relevant activities. Sometimes they're not targeted at the right individuals. Webinars, another nice thing that has become much more popular as technology has developed now. Integrated care pioneers. I mean, the King's Fund do a lot of these. And that's our minister who's responsible for long-term care, Norman Lamb. You can justify, well, you can't see him anyway. But the point is, these are becoming much more common. They provide opportunities again for offline interaction, as well as, and it puts less emphasis on having to be in the same room as researchers all the time. Yeah, no, that's all right. I'm going to get to the end. I'll be 2 minutes. Training workshops, I won't say much about those, but again, they have to be targeted at the right policymakers and stakeholders. If they're going to make a difference, we found that everyone has to have a chance to contribute, okay? But they're often not linked to policy processes. There can be personalised policy briefs. Again, we found some, this example for the Finnish Parliament. And there are policy briefs that have been prepared by the WHO level, by that chap at the back of the room, on options for funding long-term care that are meant to be short documents, concise documents, setting out the strengths and weaknesses with different funding arrangements for long-term care, and Jules was involved in that as well. And then there's something that the European Observatory has done, which I think could be thought about much more in a long-term care context, which is getting policymakers and service providers into a room with academics in a confidential environment to discuss through issues, to try and build up working relationships and trust, knowing the information is not going to leave the room. And that's been shown both in Europe and in North America to make a difference in terms of people's willingness to take on board new ideas, because they see it as something that they've been involved with themselves, rather than seeing this as an external thing, and topical relevant to all the rest of it. So observations, because I've gone through far too much, too long. Way in which information is packaged makes a difference. There are different methods of communication required, but they do depend very much on the institutional structures in countries. You have to know about the political system. I mean, obviously, if you live in the country, you'll know about it. But if you actually come from a separate country, you need to be aware of how these structures work. Interactive knowledge exchange mechanisms are better than passive, and it's important to understand the impact and the context and the way in which knowledge broking itself can work. So, far too much information, but there is an awful lot more there. Hundreds and hundreds of pages describing in detail some of these information packaging mechanisms, describing the interactive knowledge exchange mechanisms, their strengths and their weaknesses, mainly on healthcare, but I hope some of it, I think it's all really relevant to long-term care and social care as well. But the challenge is to learn from some of this, and also to learn from the weaknesses of some of this as well.